So, hi everyone, and welcome to this morning's or this afternoon's Lymphoma Australia patient educational webinar. My name's Emma, and I'm one of the nurses at Lymphoma Australia, and I'll be your host for this afternoon. In the spirit of reconciliation, Lymphoma Australia acknowledges the traditional custodians of country throughout Australia and their connections to land, sea, and community. We pay our respect to their elders, past and present, and extend that respect to all Aboriginal and Torres Strait Islander peoples today. I'll start with some quick housekeeping. If you have any questions throughout the webinar, please put them in the Q&A function at the bottom of your screen. We will have a small amount of time at the end to answer some of your questions. There is also a chat function, but this won't be monitored for questions, so please use the Q&A section if you do have a question. If you miss any of the webinar today, please don't worry. The webinar is being recorded and it'll be uploaded to our YouTube and Spotify channels within the next few days, and a link will also be sent to you. We've had quite a few patient webinars this year, and today is part 3 of a 3-part mini-series on supporting families through lymphoma. Part 1 was on the topic working and lymphoma, and part 2 was on the topic supporting partners and carers. And you can find the recordings to these 2 webinars on our YouTube and Spotify channels. If anyone isn't aware, we also hold regular online support groups via Zoom and some in-person support groups. We've just added multiple new support group dates, both online and in person, until the end of this year. So you can register for these via our events calendar, and I'll pop in a link to our events calendar in the chat section of the webinar. All right, moving on to today's topic, talking to children and young people about lymphoma, presented by parent support worker Elena. Elena Schiena has been a clinical social worker at Peter MacCallum Cancer Centre, Peter Mac, for the past 16 years, with previous service provision in out-of-home care and family services. Elena has a keen interest in working with families dealing with a cancer diagnosis to support and strengthen positive parent-child relationships during times of need and minimise adverse outcomes for children. She has conducted needs assessment research into the needs of parents with cancer, the outcomes of which have been published. Elena is a senior clinician in the parent support program at Peter Mac, supporting families experiencing parental cancer. Thank you so much for being here today, Elena.
Thanks, Emma. And thank you for having me and for anyone joining, taking the time to watch. I will share my screen so we can start the slideshow. There is a lot of information, but I do hope you walk away feeling like you have filled any gaps that you had around certain information and resources during your experience. So I'm just going to... Emma, can you let me know when that comes up?
Yes, perfect. That's full screen.
Okay, great. Thank you. Sorry, I'm just... Okay. So I wanted to just take you through what I'm going to talk about today. Why talk about cancer? So the importance of involving children in those conversations. Some common parental concerns that we hear here in the program. What children and young people understand and need through those conversations, how to talk to and support your children and young people, and then we'll touch on some signs of struggle and help seeking. Before we start, we like to include this slide because we like to consider the analogy of your cancer experience being like a journey through the wilderness. So if you cast your mind back even to when you started your parental journey, I want you to recognize that, you know, like with any journey, you're in a constant state of stepping into the unknown. And you might have had all the good wishes and love at the beginning of that journey, but also probably a level of uncertainty about how things will unfold and encounter a lot of twists and turns in that road. And the same can happen during your cancer experience. So we equate it to stepping into the wilderness, lots of unexpected areas, daunting thoughts and emotions, trying to find the clearing or the light and the knowledge to move forward in that. So I hope that the information today assists you with that. So why talk about cancer? Research repeatedly shows the benefits of children being informed, and we know that with good support, children and young people can develop some coping strategies to help them move forward through that experience. We know that when kids are given an opportunity to discuss their feelings and ask questions that may be facilitating that, they can develop the tools to be able to build the resilience that's needed. It also supports really healthy parent-child relationships. Often we find that when children are involved in those conversations, they feel they have a purpose in that family experience rather than feeling a sense of exclusion. And whilst we'll go into talking about, parents' perceptions around not telling them and that coming from a protective place, the encouragement around having those conversations is really important. As I'm sure you know, children and young people can definitely sense when something is wrong. They're very sensitive to tension and stress in the home, whether that be, increased phone calls, parents stepping out of the room to take those calls, more people coming over to help. So lots of little things that children can sense that something's going on. So if the information isn't given to them to provide a context around that, children and young people can make assumptions about what's happening that are inaccurate and can sometimes lead to more distress. So common concerns that we hear, and like I said, these come from a place of love and protection for our children. But we often hear parents think that their children are too young to understand. Concepts such as cancer may not be something that they've heard before. I don't know how much to tell them. That's a really common one. So there's lots of different questions around what's too much detail, what's not enough detail. And I'll go through this a little bit later because often that depends on the age and development of the child. What if they ask me something I can't answer? And that's also a really common one. And I think what I'm hearing when people ask me that is, what if they ask me about death? And that's probably the hardest question for parents to answer. But, we'll often say if it's around treatment or other things, depending on the age of the child, we'll often encourage parents to bring, for example, adolescents or young people into a clinical consult with them, with some preparation from the medical team or the doctor seeing them around that and giving the young people opportunity to ask questions themselves. Parents might sort of suspect or feel like, the kids are in their own world and they haven't noticed, and that can be more true in this day and age with the online world. They're in their room, they're gaming, they don't even sort of know what's happening out in the lounge or they haven't noticed what other people in the family are going through. But we know that that's not true. As we said before, the perceptions and the sensitivities around changes in the home are really prevalent in children and young people. It just might be they don't know how to ask the questions around that or acknowledge that. Probably the most common one is, I don't want my children to worry or stress. And I don't want to interrupt their studies. The studies one we hear that more and more for older age adolescents going through, for example, VCE. That's a really common thing. We don't want to interrupt their concentration around their studies. And for younger children, often it's, I don't want them to worry or stress about something they don't need to, because they're young children. We want them to be happy and play and see their friends and do all of those sorts of things. So these are just some really common things that we hear, and, interested to hear if there's some of the concerns that you've had as well. We've put this slide in because we want to acknowledge, importantly, that families are different and have different experiences and ways of communicating. You would already have a diversity of wisdom and knowledge already in your family. And what we wanted to really highlight was, it's not always what you say, but how you are with your children and young people during this experience. So in talking about children's understanding and communication needs and what parents can do, we have broken this up into subsets according to children's developmental stages. So we've broken it up into 0 to 2, 3 to 5 years, so preschool, primary school aged, high school aged, and then 19 to 25. So we do acknowledge that adolescence in the current research does tend to take that up to 25 years, just in terms of the developing brain. Apologies, everyone, if you can hear that alarm sounding in the hospital. I think I'm okay. Okay, so early childhood, so infancy, the basic needs and wants of the child are food, physical contact, and comfort. They need the routine. Verbal communication around cancer at this point is not the main priority due to that not being a capability of the child. But what they do sense is absence from caregiver, absence or reduction in sort of physical touch and comfort. So, you know, providing that physical contact and support does help foster that sense of security. It's really difficult for parents who are breastfeeding during this stage. We hear that it's actually more common than I would have thought, that sense of loss around and closeness around that breastfeeding engagement tends to feature quite a lot at this age. So routine's still really important. Children this young do sense caregivers and environmental anxiety and stress, like we talked about before. And periods of separation from their primary caregiver can be particularly unsettling. And they are very, very conscious of what's in front of them. So things like hair loss, for example, or being exposed to sort of seeing vomiting, as an example, can be quite confronting for children and can trigger that sort of distress around that change. They can become unsettled and cranky and clingy, and be seeking some more emotional comfort. Commonly, we see changes in sleep or regression in sleep patterns, but that's also something that fits into that developmental stage as well. So parents will often say, you know, is this something that would have happened anyway, or do you think it's in response to what they're seeing happening for me? And that's a really hard one to answer. I take the line of, I think we can never underestimate the impact on children of any age, but you know, maybe the way we deal with it, if it's potentially also a developmentally appropriate change, is what might guide us. Again, in terms of some regression of behaviour, bedwetting, thumb sucking, all of that sort of thing. But again, as you can imagine, that's also quite a common thing for that age. So what parents can do during this stage, providing the consistent routines and, where possible, as much of that physical comfort as they can. Recruiting alternate caregivers, that sort of comes across most age groups, having, where possible, sort of alternative support networks and caregivers who can come in and be available for that child if you're having to head off quite a bit for appointments and treatments and things like that. Following your child's cue around play and interactions, and play is the most common way for children of this age to communicate their needs. Baby massage, calming music, things like that, obviously very appropriate for that age to encourage relaxation and de-stressing. And considering any points of trigger, like we said, the hair loss, and where it's possible to have that as a gradual change rather than a sudden change for that child. Preschool age is a little sort of, we build on that a little bit. They have more of verbal capacity and be able to comprehend some information more so. They can struggle to understand illness. Limited attention span. So I often hear parents say, you know, we did try to talk to them about what was happening, but, you know, yep, they sort of sat there for a minute and then went off to play. And isn't that brilliant thing for kids to have that limited attention span in that regard. So what we often say is you probably will have to have that conversation multiple times, or you will be asked repetitive questions. That's just how they process information at that age. Keeping the language really, really simple. So what I often guide around is at least providing a context to explain any changes in the home is the foundation of what's needed. So it doesn't necessarily need to be language like cancer. It can be, obviously, but it's not as critical at this point. It's providing a context around mum or dad need to see a doctor because there's something I need to get medicine for. So Auntie Jane will be coming in to take you to kinder, and it could be as simple as that. So their thinking is very concrete around that age, and their main thoughts are around how it will affect them. So who will look after me? It says there, I caused this, and I want to explain that a little bit, because this kind of also goes up to sort of early primary school age as well. Developmentally, for children and their brain development, they're very what we call egocentric at this stage, which sort of just means that they think that everything in the world around them is around them and that they are the cause of it and it impacts on them. So children of this age can sometimes think that they can catch what you have, and also that they caused it, whether that be, sounds very irrational to us as adults, but for example, a time that they may have caused you to become upset and then feeling like that has led to you being unwell. So lots of reassurance for kids this age around what you have can't be caught by anybody else. It wasn't caused by anybody else. It happens inside the body and things like that. Again, may not have the expressive language to explain how they're feeling, but their adaptation to that can come out through their play, even drawings or stories. We can see what parents might term, tantrums increasing around this age in response to that feeling of, I know something's going on, I'm distressed by it, I don't know how to talk about it because I don't have the language tools to do that. And so then it comes out in behaviour. Younger children can fear separation, strangers, and being left alone. So again, like in the younger age group, where possible, having a familiar person stay with them, help them in preparing for changes, be someone that can fill the gap, whether that's pick up from kinder, school, whatever that might be. So what parents can do in that regard is, again, keeping explanations simple, probably having to repeat them, lots of reassurance. Picture books can be useful in this stage, and preparing them for any physical changes, emotional, social, environmental changes, and trying to keep and maintain the routines. Children have a sense of security when their routine remains the same, so that's often a focus for parents. So school-age children, well, we see them have, primary school age, increased use of logic and problem solving. So they will understand a fair bit more at this stage. They may have more curiosity about the body, so may ask more questions around how cancer starts, what certain treatments do and things like that. They may want to see wounds or ports or other things that you might have on your body. They can understand that what mortality is and that death isn't reversible. So we do know that developmentally kids around the age of 4, 5, 6, outside of this sort of cancer arena, that's when we start to see them ask some questions around death. And at that point it's around, do you die when you're old, when you're really sick? And so parents can find it understandably very confronting when those questions are asked and they feel that threat is a little more applicable to them, and you can struggle to answer that question. They're likely to encounter increased fears around what it means for them if mum or dad are sick or need to be in hospital or aren't around. They can attempt to fill the gaps themselves, so some accurate information and language is important. Funnily enough, we see that when children can sense that something's going on around this age and don't have the information around it, for some reason they tend to think that mum and dad are getting a divorce. Like, that's a really common statement from kids, that's what they jump to. So again, highlighting the importance of using accurate information to provide a context around any changes or sensitivities that they're seeing. They can still struggle to express their emotions and need assistance to regulate that. So keeping explanations simple and repeating them, normalizing their feelings and grief and reassuring them, minimizing any feelings of guilt and self-blame, allowing them and encouraging them to engage in normal activities with friends, with sports. Sports are really useful as a physical outlet for their feelings and emotions also. Assuring them that they haven't sort of had any part in causing cancer or parents' emotions around that. Preparing them for changes. We often see parents engaging kids around this age in things like, for example, if hair loss is expected as part of treatment, they may engage kids in that process, whether it be the hair removal itself or selecting hair pieces or wigs or scarves or anything like that, just to keep them involved and engaged in that. Maintaining routines and schooling. So I find probably the majority of parents I work with feel it's important to inform the school, and we definitely encourage that because that's where they spend the majority of their day, and often that's the environment where changes in, for example, concentration or behaviour can be picked up. And often if school staff and teachers aren't aware of where that may be coming from in terms of what's happening at home, it can be dealt with quite differently. So we do encourage that schools are engaged in, kept up to date about what's happening within the family in that regard. And some schools, not all, but some schools have wellbeing supports and things like that that can be engaged and mobilised at that point to make sure that kids have someone to go to at school if they need to take time out or talk to someone. As we said, involving them in discussions, in activities around treatment and cancer, and encouraging them to let them know to come to their parents with questions and not to worry alone. They may, when they're at school, you know, we hear this often, there's a concern about what other people may say to them, other children who may have had their own exposure to cancer in their family or network, which may have had a very different outcome to what your experience is. And so there's the importance of encouraging children to come to you with their questions, because you need to educate them around your unique cancer and experience rather than hear information that's not relevant to that from other people. Demonstrating positive coping behaviours as a parent is really important, and helping to regulate their emotions, and using really creative ways to encourage expression from children and encourage them and reassure them that it's important not to keep a lot of those questions and feelings inside. So one of the things we often talk about is the wish box or the worry box. It's a very general concept and something that can be tweaked to what suits your child. But for example, it might be a shoebox, a container or a jar or something that they can decorate as their own. And you might say, we're all going through a lot at the moment, and I want to make sure that you have the opportunity to ask any questions. You might feel sometimes it's not the right time to ask it, or mum or dad might be really tired, or you don't want to make them upset, but it's important for you to get them out. So they can put those statements or questions or drawings in this particular jar or box, and then you schedule some one-on-one time with them on a regular basis to go through that. And then the onus is on you as the adult to, ask questions around what that's about if they wish to explore that further. I will preface that by saying I have had some parents come back and say, what have you done? 9 out of 10 of those statements was about what they didn't like, what I cooked for dinner the night before. But, look, if 1 or 2 is important and it may not have come out otherwise, then that's what we aim for. Painting, reading, drawing, all of those creative outlets. Music therapy is fantastic in this regard. We do offer it here at Peter Mac for children who have a parent with cancer, but I know it's not something that's offered across the board, but that is a fantastic way to use non-talking therapy for children to express how they're feeling. And strategies such as mindfulness. So you may have heard of it, there's an app called Smiling Mind. It's for adults and children across all ages, and it can be really useful, for example, at times when children are showing some signs of regression with sleep, so struggling to get to sleep because their mind's ticking, they've got lots of worries and questions, and some of those mindfulness activities might only be a minute or 2 long, but they might express breathing techniques, or it might be sort of focused around calming music, but it's a great app to use to help children in sort of bringing them down, de-escalating emotions, and also encouraging them to relax and head off to sleep if that's the problem. I know a lot of schools are using mindfulness regularly in their curriculum now, so it's probably something that's not new to children. And highlighting the one-to-one time and how important that is between you and your child. And I know I'm preaching to the converted, but it's something that we often sort of talk about, because in the experience of your cancer, you are a whole other level of busy in terms of appointments and other things, and energy's low, but yeah, where you can to find that one-on-one time is really important. We put this in because this is a great depiction of adolescent, sort of what we hear from parents around raising adolescents. So it's kind of anything goes, isn't it, really? I'm not sure if any of you have adolescent children in particular, but we find that a humorous sort of introduction to this period. So the 12 to 18 year period, so high school aged, at this age, children really are forming their independence and identity, along with establishing where they fit in the world. They're comparing themselves to other people. Their friends and peer relationships seem to become more important. The online world is huge at this stage. That's how they communicate with each other. It's how they relax. It's how they zone out of studies, all of that sort of thing. They've got lots of neurobiological changes happening. They are wired to be more emotional at this age, and the frontal area of their brain is still forming. So what we see is, don't assume, excuse me, I just have a drink of water. We say, don't assume that one conversation is enough at this stage, because it's taking them a while to put the pieces together with regards to sort of more higher level information that you're giving them. So they might react more emotionally, but it's actually they're trying to process information, and that's taking a lot more time. We know as adults, when we, for example, get news of any changes in our health, such as this, we can reflect on how we responded to that. Well, they're, quite a few steps behind in terms of their brain development. So they're taking a lot longer and processing that a lot differently to us. They do have an increased risk of developing anxiety and depression around this age, just with all of the changes that are going on around them, generally in terms of study, peers, brain development, identity, all of that. but the more stress that's around them, obviously we do see an increased risk of that. So keeping an eye on them and being armed with some supports or services in the community that can step in and sort of build on that foundation of support would be really important. Schools are huge at this age. They seem to have in high school a lot more supports for mental health and well-being of adolescents, so drawing on them where you can. But generally, adolescents, they do want to be informed. They want information that suits their needs. They want that info from their parents. But it can be a useful time to ask them how much do they want to know, what do they want to know, so that they feel some sense of control around that, because developmentally what they're going through in that independence forming and identity formation is that loss of control. So giving some of that back to them when engaging in conversations about what's happening for you is really important. They're likely to jump on Google and search up information about your illness. And again, like the younger age group, that's okay because, you know, we anticipate that that's going to happen anyway, but perhaps prefacing that discussion or that activity and by saying you're likely to find something that's going to freak you out. You're going to have more questions. It's potentially not going to be accurate information because, again, your illness is unique, and you and your medical team are probably the only ones that can really answer some of those specific questions. So whilst acknowledging that they will jump online, encouraging them to come back to you with those questions, and perhaps even doing it together. Academic performance can be affected during this stage, but again, with the right supports and building a foundation of support around them, we can generally mitigate some of that. So, but it is sometimes the age where we see issues come out at school in terms of concentration on studies and things like that. Lots of schools now, as you may know, offer special consideration and deferring of exams and things like that when there's some supported documentation, for example, around what's happening for mum and dad, and being able to fit those concessions into their studies. So what parents can do at this time is obviously breathe, because it's a difficult time anyway, let alone a layer of a threat around parents' health on top of that. But empowering them and involving them and allowing them to make some decisions that will impact them will be really useful. So for example, who to tell. Some kids this age don't want their friends to know, and that's okay, because some kids are quite private and perhaps want to avoid lots of questions around that. So that's okay if they don't want to tell their friends, but you can, or their school actually, in saying that, because what you can say is explain the importance of someone at school being aware of it, at least, even if it's one person that they can go to if they have any questions. But definitely leaving the ball in their court with that regard. Encouraging them to come and speak with any doctors or treating team at your hospital, coming to see where you have your treatment, because the visual image of where you are when they know you're at those appointments can be really useful, rather than having an unknown picture of what it is that you're having to undergo without seeing it. Explaining things in simple enough terms, but obviously with more detail than younger age groups. Cancer language is a foreign language for most people, and what we find that it's one word, but we know and you know that it encompasses so many different intricacies, whereas for children, young people, and people who probably haven't had any exposure to cancer, it may seem like one word equals one thing equals one outcome, but we just know that that's not the case. There are so many different treatments, so many different outcomes. So whilst some of that can be relayed in simple terms, it does need very unique to your experience sort of language. be curious with your adolescent or young person, and where possible, still be there to guide them through tricky life situations, lots of friendship challenges at this age, sometimes even just acknowledging that these are some of the things they may experience in their life generally, and that, you know, you understand what you're going through is also having an impact on them. But asking some check-in questions around how that's going for them can often be the start of a conversation. Encourage healthy and demonstrate healthy problem solving and support seeking, because we know that adolescents and young adults, if they haven't had a positive experience of proactively seeking support, they're less likely to do that again. So talking to them about supports at school, or whether that might be in the community through private psychologists or counsellors, but speaking about that in a positive way, because that will set them up as they go through life in a positive support seeking sort of behaviour. And also working with their strengths and promoting their significance in the family, because if they're the kind of child to sort of retreat into their room, or, you know, be online a lot and things like that, they're not out within the family, but they can sometimes feel like they're forgotten in that. So definitely sort of promoting their significance and involvement in your family unit is really important. So 19 to 25, this is often where young people are sort of exiting studies and moving into a workplace or a career, or heading into further study. Still lots of changes happening as they transition into that adulthood, and they can feel like they're losing a little bit of grounding when things may be unstable at home with illness or significant changes. So at this age, they're often, whilst we think of them as young adults, they can actually be still very dependent on parents, whether that be financially or living in the home, and things like that. So still very much part of the family unit, whilst sort of flitting in and out. Peer relationships are still really important. Intimate relationships develop. So you know, whilst that might expand their support network, it can also mean additional stress, as we all can reflect on, in terms of when you develop a new relationship. Brain development is still happening, as we talked about before. We know that with research now that has gone up to the age of 25, they're saying. Continued risk of developing anxiety and depression. But again, having modelled some of that positive help-seeking behaviour, there are lots of great services out there for young adults of this age. Still empowering them and involving them and in their decision-making is really important. Lots of young people at this age tend to take on a greater caring role with a parent, and maybe the ones transporting to and from hospital and treatment, for example, so much more involved. Encouraging them to keep up with their young people activities though. So, you know, whether that's partying, being with friends, studying, all of those sorts of things are really important. Risk-taking around sort of 17, 16 and above is quite common, and potentially more likely if there are additional stresses in the home. But again, drawing on those positive aspects and identifying support networks can buffer that. And encouraging the healthy supports for seeking. So, you know, whilst we've talked about all that, I do often say there's no right or wrong when it comes to a particular way of communicating, because we know that every family and every parent-child interaction, you know, there's a very unique relationship with any child or young person. So utilising how your family communicates anyway is the way to go, and just building on that. And you might feel like you could have done it better, but that's okay, because you can go back and do it again another time. It's never just going to be one conversation. It's going to be multiple. So how to prepare for those conversations? we'll often talk with parents, like I said, about the family's unique communication style or engagement style with your child or young person. What do you think works based on their particular personality? You know, for some children, it might be dipping the toe in the water first and then coming back to revisit that. For others, they might know that their child needs a lot more of that direct information up front. So using what you know about your children, because you know them best, and you're delivering it that way. You know, what values, beliefs, and supports are important in your life that you can draw upon. And for some families, they've already experienced grief or loss or illness. So you may have something to draw upon when it comes to what worked last time, what would I do differently this time? For some families, you know, honesty and transparency is an important value, and that will guide the way you deliver that conversation or that communication. And do you feel up to having them? Because if not, it's okay to have someone else be there with you while you do it, or that, you know, they are perhaps the speaker and you're there to observe it and be part of it and answer any questions. And always just feeling like, you know, take the time to process the information yourself before you feel you can deliver it to others in your family, because you know, it is very confronting. And whilst it's okay to be emotional, we do, you know, that's encouraged in a way because it allows your children or young people to feel they have permission to show those emotions as well. But feeling where you can do that in an appropriate way. So when talking about tips for effective communication, an honest and open approach is the most empowering. It fosters that building on parent-child relationship well-being. Choose times when you know you have good quality connection and conversations. We know that, funnily enough, for some people, when you're in the car and there's less sort of eye contact and that sense of having to look at you in the face, or that confronting nature, that's often a time to have perhaps not the first conversation, but subsequent checking in. How are you going? It's been busy for me. You know, what's it been like for you during this time? For some children, it's whilst they're engaged in something with their hands, because it distracts them from, again, that eye contact or that direct emotion. So might be whilst you're cooking, or whilst you're playing a sport with them, or going for a walk, or anything like that can be good times. It might be at bedtime, when sort of the events of the day have calmed down and there is that sort of time to sit and talk a little bit and check in. Start with questions and check children or young people's understanding. And this is often a question we get asked, you know, how do I start the conversation? And sometimes it's okay just to say, to ask your child or young person what they think is happening, because sometimes we assume they're at the point of 2 out of 10, for example, of understanding what's happening. But when you ask them, you know, what you've noticed mum and dad sort of having lots of appointments with doctors, what do you think is happening at the moment? Their answer might show you that they actually are at an 8 out of 10 level, because they've sort of started to put the pieces together themselves. So to allow you to start where they're at, you can start with asking them what they think is happening and go from there. It also allows you the opportunity to clear up misunderstandings about any assumptions they've made that aren't true. And listen. So what's really being asked? Sometimes there's a question behind the question they've asked. For example, you know, are you coming to my basketball game on Saturday? Well, you know, whilst that might be quite a practical question, perhaps what they're asking is, are you okay? Is everything okay with you? So really sort of being sensitive to what is behind the question they're asking. So, I mean, this is sort of recapping, but for younger children, keeping it simple is really important. Talking in terms of how it will affect them. So any changes in people picking them up from school, for example, reassuring them that they will be looked after. For older children, still keeping it simple, but adding a little bit more, following their questions and cues, and be prepared for all kinds of questions. Again, describing how it will affect them, and reassuring them that they can ask anything that's on their mind, whether that be directly to you or via another means, such as the worry box or the question jar that we talked about. That sort of goes into early adolescence as well, with the additional sort of element of considering the impact of the online info that they can get, and their peer world, keeping communication open. And with adolescents and young adults, not always assuming that they want others in their world to know, allowing that sense of keeping it private if they need to, checking what they already know, and they may prefer to speak with someone else, and that's okay, because it is, amongst all of this, important to explore what other trusted adults in their network, whether it be extended family members, even a really much older sibling, for example, or even professional supports that they can go to rather than their parent, and giving them permission to do that, because sometimes the biggest barrier for children and young people to talk to their parents is the fear of making their parent upset. So allowing them that opportunity can be helpful. In terms of coming into the hospital, either whilst you're an inpatient for a period of time, or for particular day appointments even, we really encourage that, because like I said before, it gives them a visual image of where you are when they know you're there. So, and you're not, and they're not, sorry. So that they don't imagine, for example, a torture chamber, or, poking and prodding, whilst I know that sort of happens, but, in a fearful sense for them. So being able to come and visit, even if it's, for example, I know in this centre, there are various cafes. So we'll often say, for the first visit, bring them along, but take them up to the cafe and get a milkshake or something, or, make it a positive experience, so that it's not something that they fear coming into any other time. If that's not possible due to distance, or, logistical reasons, having that available via FaceTime, or even taking photos of yourself whilst you're having treatment, so that they can see the surroundings, so that they see you're okay, and things like that. So that's really helpful for children of any age. Role playing with toys or via stories for younger children. There are some books around preparing to come into hospital. Sometimes what they need to know is that they might see other people who are really unwell, and that can be the most confronting thing for them. So explaining what they might see with other people, with equipment, anything like that, is always really helpful in preparing them before they come in. Also, allowing them the opportunity to say they don't want to come in. So that's at your discretion, obviously, because if it's something that's going to be quite fearful or traumatic for them, then that's something to consider. Just mindful of time, so I might just sweep through these. As I said before, if you feel like it didn't go too well, take a breath and try it all over again. There will be multiple opportunities. Signs of struggle and when to seek help. Often important to think about, what was your child or young person like before cancer came along? Are there behavioural changes or things that you're concerned about that have a very clear sort of trigger point that started when they were aware of what was happening for you? Or were they struggling with anything prior, particularly with any potential mental health issues that you might have seen signs of earlier, that are now perhaps exacerbated with the additional stress? That might determine for you when to seek additional help. I always err on the side of caution and encourage parents to seek professional help anyway, because I feel like even for young children, for example, seeking a community-based psychologist or counsellor, I just never think there's any harm in that, because it does then build strategies for them to manage stress as they get older. So sometimes that's a deciding factor when you consider what your child was like before this happened. what are their strengths? Where do you think they have some vulnerabilities? So pinpointing potential vulnerabilities that you saw before and how the additional stress might challenge that. And so that might be a, yep, I've got to get onto this, ASAP and get some additional support. Some of those regressive behaviors, particularly with young children, they can be a really common response to adjusting to changes in the home. And so sometimes that might just be letting that play out. But I think it's really up to the parent to say, I feel like it's gone beyond a certain point and it is impacting a lot more on day-to-day behavior. So that might be the stage where you think seeking additional support is going to be really important. Increasing withdrawal from adolescents and young people, if that starts to become more common than not, then obviously sort of that's a signal to seek some additional mental health support for that young person. And do you need practical support? So for young children, is it impacting on childcare? Are there things like in-home childcare that would benefit? So that's something that is offered as part of the additional childcare subsidy through Centrelink to enable, for example, children who attend centre-based childcare to have that delivered in the home, because that, for example, if you're immunocompromised through your treatment, and we all know what childcare is like with illnesses and bugs and things, so if it meets the need of the child, still gets that childcare and education, but it's delivered in the home to protect the health of the parent, then these are all sort of practical supports that can be offered. Cleaning support in the home is something that various agencies offer, sometimes at a cost and sometimes not, depending on how that's delivered, either via the hospital or paid services. And sometimes, like we said before, building a trusted support network, sometimes you can use the analogy of, with children, hold up your hand, you've got 5 fingers. Let's identify 5 people that you trust in your life that you could go to if you were upset, if you had questions, if you needed some time out. So lots of different ways that you can encourage children to think about support for them. Let's see, what have we got? We've got 5 minutes. All right, so considerations, I'm just going to flick through these. It's a lot of recapping. Maintaining routines and discipline, preparing for anticipated changes, particularly visual ones. They can be the most confronting for young children, and involving them in that. Consider establishing communication agreements, like scheduled time for talking about cancer, establishing roles for maintaining those life schedules and household tasks. Young children particularly, but even older children can feel like they're a sense of purpose and help if they are given additional responsibilities at home, but being careful as they get older that doesn't overload them and promote a sense of guilt if they don't do that, because that's probably another carer burden that we try to avoid. Find ways naturally to let off stress, stay connected with friends, maintaining connection, planning family time and holidays if that allows, something to look forward to. What else have we got? And just this analogy of show you care. So be curious, be aware of changes, be real, that we know that for kids and young people, life is not just about cancer. So they have so many other things going on, and being aware of and acknowledging the importance of all of those things, and engage in their world as much as you can. I have put some resources here, and I can send Emma another list of particular resources that can be helpful, but the main ones, obviously, Cancer Council have a great book called Talking to Kids About Cancer, which breaks it down into the developmental stages. It also breaks it down into sort of early diagnosis versus what happens when we get to the palliative care side of things and end of life. So different ways of communicating in those areas. Camp Quality has a great app, particularly for children aged 8 to 15, and it's an animated visual app that's quite interactive. For younger kids, we'd encourage parents sitting with them and doing that, but another one to consider. What's Your Grief is a great website that has lots of different resources on anticipatory grief, grief and death and bereavement. And Canteen is a service for children aged 12 to 25 who have a parent with cancer. Used to just be for if that young person had cancer, but now has expanded quite a lot into supporting young people who have a parent with cancer. They also have various webinars, online support for parents with cancer around parenting. So that's another great resource to check out if you have children in that age group. Emma, I think that's about it from me, but I did want to give an opportunity for questions if that was something that had come up.
Thank you so much, Eleanor. That was incredible presentation. If anyone does have any questions, please pop them now into the Q&A section. But I do have a couple of questions of my own. First of all, in terms of a lot of our particularly indolent, slow-growing lymphomas, we know that they're going to come back at some point, or if, for example, an aggressive lymphoma has relapsed. Is there any kind of tips or different ways to approaching communication at relapse? Because I can imagine that would cause kind of a different level of maybe stress and anxiety for children.
Yeah, absolutely. So sometimes it's the tweaking of the language when children are first aware of an initial cancer diagnosis is sometimes, particularly with blood cancers, we know that there's not always just a cure, it's not a matter of the tumor has gone and therefore there's no more cancer. We probably would encourage saying at the outset that sometimes these types of illnesses can come and go and they can be gone for a long time, but they might come back. So always having that door slightly ajar without trying to create that distress, but then it allows you when that relapse has occurred, you've got that previous information to go back to. But again, it comes down to that education and information about that unique type of cancer, lymphoma.
And I was just going to ask, in terms of like when we're using particular language or educating or talking to children or young people about cancer, should people then be communicating to close friends and family about what the child what the child knows and what kind of language to use, and should it kind of be everyone aware of how the communication is happening and what they know, just so it's that consistency for that child or young person?
Great point, Emma. Absolutely. Definitely those closest to the child who are likely to have those conversations, if they're aware of how that's being delivered, absolutely important so that there's not mixed messages around that. Yeah.
Yeah. And I didn't know about the in-home childcare through Centrelink, which is great. So that's available for all Australians across Australia to access that?
Yeah, so there is an eligibility criteria, and very briefly, it's that parent is eligible for the childcare subsidy, because then the added layer is the additional childcare subsidy, which incorporates any in-home care. The additional childcare subsidy also allows for more hours at a higher subsidised rate for centre-based childcare as well. So it's just a level up. Often what's needed to enable that, supporting evidence from the hospital or treating centre, a social worker, things like that, that sort of depict a holistic explanation of the situation.
Yeah, that's really great that they have access to that kind of support.
Yeah.
I guess my last question, and someone's just popped in the Q&A section, they had the same question about the relapse. So that's good that we've answered that. I just had a question as well. Some of the people that might be watching it, they may not be parents but grandparents. So would these kind of resources that are currently on the screen, or this information, I suppose it would be relevant to those people as well if they have young children or grandchildren in their lives?
Yeah, absolutely. there isn't a lot out there targeted to grandparents in this situation, but we do say it is very applicable.
Yeah.
Across the board. You know, sometimes that does come with some additional complexity. So we will sometimes get referrals for grandparents who have, for example, full custody of their grandchildren. And so then the potential threat of illness can sometimes have a slightly different layer of fear because there isn't a parental support network around them as such. But it's also applicable for grandparents who babysit a great deal their grandkids and spend a lot of
Yeah.
time with them and want to know how to support that communication too.
Yeah. Yeah. And any particular or different advice for, say, single parents that may not have a great support network, and maybe the young person is taking on more of a carer's role for their parent in that situation? Is there any kind of different communication or advice
Mm,
around that, or is it similar?
that's a huge area. There are some young carers agencies. I know in Victoria, I'm pretty sure Australia-wide, but I can double check that for you, that can provide that support. But in terms of communication, it is around trying to avoid that young person feeling like they're responsible entirely for that care, and making sure that they do have outlets and other, normal adolescent young person type activities happening. Yeah, but I would say engaging professional supports would be probably more likely in that regard.
Yeah.
Yeah.
I don't think we have any other questions in our Q&A section. So we might finish up the webinar there. If anyone does have any, questions afterwards, please feel free to email our nurse inbox or call our nurse support line on 1-800-953-081, and we can try and answer your questions on either of those platforms. Thank you so much again, Eleanor, for
You're
coming today.
welcome.
We really appreciate your time. And I'll send out some of the resources with the recorded webinar link to everyone who's registered for the webinar. So thank you so much, everyone, for joining us today, and I hope you enjoy the rest of your day.
Thanks, Emma.
Thank you. Bye-bye.
Bye. Is it just us?
Yeah, just stop recording. I don't know where. Oh, yeah.